And welcome to another informative segment of our Medicare series here at Senior Health Medicare. Today I have Jim St. John and Allie Giardini, and they are here to discuss when can you change your Medicare plans and the timing of plans. So without further ado, I'll let them take it away. Jim and Allie?
Thank you, Courtney. Appreciate it. Welcome, everybody. And my name is Jim St. John. Been in the industry for at least 5 years and own my own business for 20 years. So love customer service, love customer care, and leading people to the right path of what they need to do with their Medicare. And I'm teamed up with Allie today. Allie, share a little bit about yourself.
I am Allie Giardini. I grew up with insurance being in my life. I graduated from Michigan State University and decided to join my mom and my brother here at Senior Health Medicare, along with the other agents we've got in the office. Decided to hop on and help everyone out with this confusing time of their life. So with that being said, our first topic today is going to be the annual election period. A common misconception that we find is that many people believe that the annual election period is the only time that you can change all your Medicare plans. So when we come to the annual election period, this only refers to Medicare Part D, your prescription drug plans, and the Medicare Advantage plans. This time of year is the only time that we can shop for the new prescription drug plans and disenroll you from the Medicare Advantage plans and put you on a Medicare supplement. When we talk about Medicare supplement plans, you can change those at any time of the year. And the only thing you have to worry about is going through underwriting. So if you're healthy and you believe you can pass underwriting, give us a call anytime during the year, and we can look and shop around and see what will best fit your budget and your needs for your Medicare supplement plan.
That's a great point, Allie, because underwritten is really, don't assume that you think you can't pass or what you can or can't do. Let the agents here at Senior Health Medicare guide you, take it through a process. We keep it real simple. Sometimes people think underwritten is like a big, hairy mental monster, and don't make it that way. They're underwriters, not undertakers. Okay, just keep that in mind. Okay. So how often should I shop plans? Well, Medicare supplement plans should be shopped every few years because if you're healthy, first of all, you can shop any time throughout the whole year, just like Allie talked about. It's not one time a year, it's throughout the whole year. You're a free agent. You have autonomy, so you can be flexible and shop around. Again, don't assume that you're not healthy or you are healthy. It only takes 7 minutes for these health questions. Folks, we do everything over the phone. It's very unobtrusive. No one's going to visit your house, give you a physical. It's very simple, and we'd like to just take you through that process because we do it very well here at Senior Health Medicare. If you haven't experienced large rate increases, if you have experienced them, you can shop before a year. You can, call us and let us know, listen, I'm experiencing some major rate increases, or, I don't like the coverage I have. Call us. Again, we're flexible here. You have autonomy. You're a free agent. When it comes to Medicare Part D plans, you need to shop that every year, like Allie just mentioned about. It's one time during the annual election period, and so we can, help you find the new plans that come out. Maybe you have a plan you like. Maybe it will continue. Maybe it might be discontinued. Okay, that's why plans change, formulas change, you change. I mean, your needs change. You may have another medication that popped up throughout the year that your current plan does not cover very well. We can find a new plan to help you with that too here at Senior Health Medicare. Medicare Advantage plans are annual. During that annual election period, again, it's very important that you can only opt out and opt in during that time, and so we can definitely help you with that situation. Now, we talk about enrollment periods. I bet you didn't know there's different enrollment periods. We got annual enrollment period, annual election period. Most people call it open enrollment. That's between October 15th and December 7th. That's kind of like our Super Bowl of Medicare. I call it our tax season, like rush hour. It's just everything happens at this time. Things take longer. So if you do have a supplement and you're listening to this right now in September, call us now. Beat the rush hour. Beat the rush and beat the crowd, because you'll be glad you did, because it just takes a lot longer. Your process just takes a lot longer. But October 15th to December 7th, that again is for Part D drugs, and that's also for Medicare Advantage plan. So Medicare Advantage plan disenrollment period. I bet you didn't think there was an enrollment period after open enrollment. Yeah, we call it OOPS period, okay? That's for people that basically either forgot that there was an annual election period, or maybe life happened and you had some tragedy or whatever and you just got caught in between a rock and a hard place. Well, guess what? We have grace, all right? We have a second chance, and we can guide you through that process during the annual disenrollment period. That's between January 1st and February 14th, okay? That's what that is. So special enrollment, election periods, case-by-case examples. Don't ever think that you're doomed and you can't move or you can't, get a different plan. We have answers for everything. We have different companies that are great with certain ailments, and there's other companies that aren't. Guess what? We're going to fit the company to your needs and not you fit into the company's needs, okay? So that's really important. So Allie's going to talk about some other enrollment periods too.
Thanks, Jim. So I'm going to briefly touch on guarantee issue and open enrollment periods. For more in-detailed information regarding this particular topic, visit our other webinar that touches on guarantee issue and an open enrollment periods. So guaranteed issue and when am I eligible? So if you happen to miss your open enrollment period, say you're still employed and you still have that credible coverage, you are eligible for guarantee issue when you come off of that employer coverage. What guarantee issue is you have access to certain plans with companies with no underwriting questions asked. Call us for more information on the exact plans that we can get you, and with the different companies we can get it for you. And then your open enrollment period, that's going to be 6 months before you start your Part B and 6 months after you start your Part B. This is no medical questions asked. Doesn't matter if you're a smoker, non-smoker, you get that preferred rate that everybody wants. So make sure you don't miss that open enrollment period when you have the chance to do so.
All right, that's everything. We have one question that came in, guys. So Susie from Michigan says, I heard from my neighbor that we can't switch our Medicare supplement until the annual election period. Are you sure that I can switch anytime?
We are positive, Susie. Yes, yes. Again, the misnomer is that I can only, do it between October 15th and December 7th. Medicare supplements, you are a free agent. You have autonomy, and you can change anytime throughout the year. Anything else, Allie?
Yeah, this is actually a good reason why it's not always best to listen to your aunt, uncle, neighbor, best friend, whoever it may be. It's really important to call one of us here at Senior Health Medicare. We specialize in this. We do this 9 to 5 every day. This is our job. We want to help you make the right decision. So be careful who you're listening to, and always give us a call to double check if you're hearing the right information, so you can fit your needs the best way you can.
Yeah, good movies, good recipes are great for friends, but Medicare, come to us. So, back to you, Courtney.
All right, great. Thanks so much, Jim and Allie. And I just wanted to say real quick, we touched on some topics like underwriting and open enrollment and guaranteed issue. We do have other webinar sessions that are specifically in detail to those topics, so be sure to check those out at our website at www.seniorhealthmedicare.com. And we thank you for joining us today and look forward to hearing from you soon. Bye-bye.
The moderator has left the conference.